the upgrading of the standards and capacities of local drug manufacturing facilities like Joe in Anambra State and May and Baker in Ogun State is also a major achievement. This has resulted in a decrease from 16.5% to 7.5% of the incidence of fake drugs in Nigeria.
We have been able to bring in within this short time cutting-edge technologies that will now be used by NAFDAC to fight counterfeiting. The TrueScan, the text messaging system that is already being deployed in the store, the mini labs that are coming to our borders, and the TrueScan that will be in the medicine stores.
NAFDAC has put in place an e-registration process that has hastened applications for registration. Also, with the completion and commissioning of the National Institute for Pharmaceutical Research and Development (NIPRD) office complex by Mr. President, Nigeria is now better positioned to improve its research in pharmaceuticals, especially herbal medicine. Nigeria has introduced the new CSM vaccine, MEN-Afrique, which confers protection for at least 10 years as against 3 years with the previous vaccines. It also achieved the following: control of yellow fever, new security featured International Certificate of Control of Cerebrospinal Meningitis (CSM), vaccination and prophylaxis (ICVP), popularly known as Yellow Card, has been introduced. Mass yellow fever campaign, introduction of pentavalent vaccines DPT, HP, HIV. This will help protect against childhood pneumonia and hepatitis B. Establishment of the Nigeria Center for Disease Control (NCDC). While Nigeria has received accolades and applause from the international community and development partners for the Jonathan administration's interventions and flagship policies, programs and projects, one key achievement of Mr. President that will remain chronicled in the sands of the nation's life is his swift and proactive response to the outbreak of the Ebola virus disease in Nigeria, which was dubbed in many quarters as a Bailey's War on Ebola. On the 20th of July, when a Liberian-American diplomat, Mr. Patrick Sawyer, imported the Ebola virus disease (EVD) into the country, the president quickly swung into action, and before the disease claimed the index case on the 24th of July, President Jonathan introduced the National Ebola Virus Response Plan, and all primary contacts with Mr. Sawyer were immediately quarantined. Mr. President mobilized resources and provided the inspirational leadership which stopped the disease from spreading further to other parts of the country. President Jonathan declared the containment and control of the Ebola virus a national emergency with immediate cash backing of 1.9 billion naira. He also directed the Federal Ministry of Health to work with all the state ministries of health, the National Emergency Management Agency, NEMA, and all other relevant agencies to effectively contain the spread of the virus in line with international protocols and best practices. Following the directive of the President, the Minister of Health, Professor C.O. Onyebuchi Chukwu, ensured his ministry and other relevant agencies moved to work on the containment plan. The minister practically moved to Lagos to ensure the president's order was followed to the letter.
A few days ago, the Federal Ministry of Health was alerted on a suspected case of Ebola virus disease in Lagos. And this involved a 40-year-old male who traveled from Monrovia in Liberia to Nigeria on Askai Airline via Lomé, Togo. This passenger arrived Lagos through the Muritala Mohammed Airport on the 22nd of July this year. He presented with fever, vomiting, and diarrhea on arrival at the airport. The Port Health Division of the Federal Ministry of Health quickly isolated the passenger and transported him straight to the hospital, avoiding contact with the general public. The patient was subjected to thorough medical evaluation, where laboratory investigations were also carried out. His blood sample was taken to the advanced laboratory at the Lagos University Teaching Hospital, LUTH, which confirmed the diagnosis of Ebola virus disease. In line with the World Health Organization international health regulations, and in keeping with international best practice, all ports of entry to Nigeria, including airports, seaports, and land borders, have been placed on red alert. The staff of the Federal Ministry of Health are positioned in all these locations. Active surveillance have since also been stepped up. All the government tertiary health institutions in Nigeria have already been equipped to handle any emergency that may arise from this disease. Drugs and medical consumables are presently pre-positioned while we are working with all states of the Federation, especially those with ports of entry, to mitigate the situation. All citizens are implored to be vigilant and to ensure improved personal and environmental hygiene, and also report any suspected case to the nearest medical facility.
The fight against the dreaded disease has recorded positive results.
Presently, as we speak, there is nobody suffering from Ebola virus disease in Nigeria, and it has been so for the last 1 week.
The World Health Organization announced a new record death toll for Ebola virus in West Africa, and simultaneously it also gave the cheering news that the virus has been contained in Nigeria. The UN Health Agency said 2,793 people have died out of 5,762 infected as at 18 September, noting Sierra Leone's shutdown for 72 hours in the wake of its crisis following the outbreak of the Ebola disease in that country. Guinea, where the outbreak began at the start of the year, and neighboring Liberia and Sierra Leone by far account for most of the cases and continue to see ballooning numbers. Liberia has been especially hard hit with 3,022 cases and 1,578 deaths alone. The WHO said in Nigeria, where 21 people have been infected, 8 of whom have died, the country has not reported any new cases since September 8. No doubt, the administration of President Goodluck Ebele Jonathan has provided a new sense of direction with people-oriented policies and programs that will ensure that the nation is also adequately empowered to meet the future needs of their people. Indeed, the transformation train is moving. A lot has been done, and a lot can still be done. Mr. President, keep on walking the talk of transformation.